Okay, we'll get started. So good afternoon, everyone. I'm Josh Jabal. I'm Chief Operating Officer for the state of Connecticut, and I'm heading up, on behalf of the governor, the cross-agency group that is working to respond to COVID-19. I'm joined by several of our commissioners and Dr. Matt Carter, state's chief epidemiologist. We have a number of updates to provide, and we're going to start with some updates from the public health side with Dr. Carter.
Good afternoon. My name is Dr. Matthew Carter. I'm the state epidemiologist with the Connecticut Department of Public Health. To start out with, I'd like to acknowledge for all the folks that are out there that what we're going through is incredibly difficult. We have not seen a pandemic like this in 100 years. And none of us who are in this room today have ever been through anything quite like this, with a new virus that none of us have ever been exposed to before, crossing the world, and now in the United States and now in Connecticut. These are challenging times. But like other pandemics, there are things that we can do to slow it down, make sure our hospitals stay open so that they can take care of people who get very sick. We know that the vast majority of people who do get sick, at least 80% of them, will not be sick, can recover at home. They will not need to be hospitalized. Others will need to be hospitalized, and treatment will help them. We don't know what the mortality rate will be for this disease in the United States. We know that some of our citizens and residents of Connecticut will not survive this, but our goal is to make that number as small as possible. Yesterday, the State Health Department laboratory confirmed a third case of COVID-19 involving a Connecticut resident, a resident of New Canaan. This person is elderly and lived at home. This person has no known exposure to COVID-19 that we have been able to identify yet. This would be a community-acquired case of COVID-19. Right now, the State Health Department is working with the local health department to identify contacts of that person and make sure that they are at home if they are well, and those folks will be monitored. If they develop illness, testing for COVID-19 will be arranged for those contacts. This period of case investigation and contact investigation is probably not going to last very long, maybe a week or two, because after that there'll be so many cases that it will not be practical to actually continue to conduct in-depth interviews with cases and identify their contacts. I think the message that I want for folks, and I've gotten a lot of phone calls in the last 24 hours, is that we need to assume that COVID-19 is here. That is especially true in the southwestern part of the state. You've probably all seen the media articles about what's happening in New Rochelle and Westchester County. There are people who drive back and forth between Connecticut and New York every day. But we also have an outbreak in Massachusetts and an outbreak in Rhode Island. And it is only a matter of time before we have widespread community transmission throughout the state of Connecticut. The people I've talked to have said, I've got a fever and a cough. I feel like I've got the flu, but what should I do? I'm home. We're saying if you have fever and a cough, for example, and you are in the southwestern part of the state, you should assume that you have COVID-19. You don't need a test to tell you that that's what you have. You should assume that that's the illness that you have. Most people will get better at home, especially the younger you are. That will be the case. You should talk to your physician. They can provide you advice for how to care for somebody with COVID-19 at home. There is guidance on the Centers for Disease Control website about staying at home, taking care of people at home with COVID-19. At this point, our state public health laboratory is only doing testing for people who are hospitalized and who have fever and cough and shortness of breath. The reason for that is that's critical information for our hospitals to use so that they can stay open. They need to be able to identify patients with this so that they can take appropriate precautions in the hospital and protect our healthcare workers from getting infected. This is going to be critical because we're just at the beginning of this at this point in time. It is our understanding that the commercial laboratories, Quest put out an announcement on their webpage today saying that they're open to receive samples from the entire country. That's different than a couple days ago when they said they were only accepting specimens from the western part of the United States. Other labs are coming on board. We hope to have at least one or more of our hospital laboratories having testing capacity sometime next week. This will take some of the burden off the state public health laboratory. Testing will be increasingly available, but you do not need to wait for a test result. You should assume that if you have fever and cough, and think about those times when you've had influenza, fever, cough, headache, muscle aches, body aches, and you feel like you've been run over by a truck, well, throughout this winter, that was probably influenza. But moving forward, that's probably COVID-19. And we take care of people all the time who have influenza. There are special instructions for COVID-19 on the CDC website for taking care of people at home, and we ask for you to do that. Right now, that's the biggest thing for folks, and all of you in this room may well be dealing with decisions about family members relatively soon. Somebody who gets a fever and a cough, who stays home, who takes care of that person? These are things that we will all have to figure out how to do. And those of us who are older and over the age of 65, there's at least one or two of us in the room, we'll have to make decisions about, do we avoid crowds? That's the current recommendation. Or a family member gets sick. Do we go take care of them? Or do we wait for them to get better if they're 22? These are all things that, as individuals, we will have to make decisions about as we move forward. And this is difficult. But our goal is to get, as a community, through this all together as best we can. That's my update at this point in time.
Dr. Carter,
Just, Mark.
I've got some very important questions for you. We've heard from a number of package store owners and beer distributors that are concerned about receiving unwashed bottles, empty bottles and cans for deposit. Should that be suspended in your view?
This virus doesn't last very long on surfaces. That's the good news. I mean, many of you may have heard the word norovirus. That's the one that causes nausea, vomiting, diarrhea. Well, that virus is really hard to kill, and it stays around on surfaces for days. This one does not. It's actually easy to kill, lasts on surfaces maybe an hour, maybe a day. So bottles, cans, if they've been in that system for a little while, they don't have viable virus there. That's not going to be the issue. This is going to be really person-to-person transmission in the sense that being close to somebody who's coughing or sneezing, who's actively sick, or somebody who's coughing and sneezing and may have touched their nose or and then touched the door handle, and then you touch that door handle right afterwards. That's going to be the issue.
Okay, thanks for that, because that seemed a very urgent question.
Okay, a couple other updates. In light of Dr. Carter and our public health team's assessment of the situation, the governor's been busy today on the phones. He's been speaking extensively with leaders of some of our large employers. He's been speaking with a number of leaders of our large religious organizations. He's spoken with Scott Gottlieb, former commissioner of the FDA, also a Connecticut resident, who some of you may have heard on the radio this morning. I did on my drive-in, sharing broad messages, very much in line with what we've been doing in Connecticut to be very proactive about looking at large events and the types of interactions that, as Dr. Carter described, are at high risk for transmission of COVID-19 and looking to discontinue those. And so the governor's been sharing our position as a state and the things that we're recommending people do. My sense is that there's not anyone who leads a large organization in this state or probably in this country at this point who's not looking very actively at large events in particular and looking at ways that we can either discontinue them, turn them into teleconferences, postpone them, or take other actions to reduce the risk. Another update is that today we, in anticipation of what's to come, we took the step to, in recognition of the known fact that there's a global shortage of personal protective equipment for people who will be dealing with the acutely ill patients. We've made a request of the the Strategic National Supply for a total of 540,000 additional N95 protective masks. So we don't need this today, but we're planning ahead in anticipation of needing additional supply in the weeks to come, and we expect to receive the first delivery of that next week. Finally, we were also notified today that state of Connecticut is going to be receiving $7.1 million as funding through the public health emergency funds in the most recent federal appropriated bill to help fight COVID-19. The mechanism for how that will be distributed is still to be communicated by the feds, but we have been given indication that that funding is on the way. And I think with that, we will take your questions.
The case, doctor, was where again?
Oh, New Canaan.
New Canaan?
Case involved a resident of New Canaan.
And did you say it was elderly?
Elderly, yes.
What does that mean to you?
It's a man or a woman?
Older than you and me.
Did he give us the-
Over
I mean,
65.
Over 65?
Yes.
It's a man or a woman? Did you say it was?
I didn't say.
You didn't, okay.
It is a man.
Okay, thank
It
you.
is okay.
Yes.
Did you say where he contracted the disease?
Unknown. That's why we're assuming this is a case of a community transmission.
So if he has not had contact with anybody with the disease, so how might somebody who has not had contact with anybody get
Well, that's
the disease?
where the case investigation comes in. It's trying to interview the case if possible, identify anybody he may have had contact with in the week before he became ill. That's in progress. But right now, this isn't like the other two cases where we knew the person became ill right after returning from California or right after returning from Nevada.
You stress the need to be vigilant now because the virus is here, but eventually, like the flu, it will slow down. Can you elaborate on that? I mean, what do you suspect will happen?
Oh, that's a great question, and thank you. I don't have a crystal ball. I mean, we're assuming that this is going to act like other respiratory viruses, like the flu. And when flu comes, it's usually here for 6 to 8 weeks. If it acts like this, if this coronavirus acts like influenza, this will be what's called, pandemics are not like seasonal diseases. They happen at times of the year that aren't what we normally see, like March and April and May. If this is anything like the pandemic of 1918, I'm not saying this is going to be as severe as 1918. It seems pretty clear that that's not going to be the case. But what many people in public health who do this work related to epidemics think that this could be a spring wave. Well, we'll see transmission for 6 to 8 weeks in this period. If you remember, 2009 was the H1N1 pandemic. It was no more severe than seasonal influenza, but the first cases were diagnosed the last week of April, and we had cases in Connecticut in May and in June. And I remember standing in an elementary school where the absentee rate was 40%. But because it was no more severe than seasonal flu, no schools were closed at that time.
Because we had a public health emergency in 2014 with Ebola under Governor Malloy, but
That was a very different circumstance.
Very different.
Because Ebola is transmitted in a very different way. It's really bloodborne. I'm trying to draw the analogy that, because you asked me what do I think may happen. I think we'll see a first wave between, over the next 6 to 8 weeks. I don't know that for certain because this is a brand new virus we don't have experience with, but we know other coronaviruses that cause the common cold, for example, are seasonal. In pandemics, it may well be that we have a second wave in the fall, just like in 2009. If you recall, we had cases in April, May, and June, and then we had a second wave in October and November and early December, which is really early for flu. But that was the second wave of the pandemic in 2009. And so this may well occur where we're dealing with a wave now and a wave later. Right now our focus is on trying to mitigate the first wave and to slow it down so that we don't want everybody getting sick all at once. Because if everybody gets sick all at once, the hospitals are overwhelmed and you can't take care of people who need to be hospitalized. So the goal here is to slow down the transmission so that our hospitals can stay open.
There's 10 minutes left. We got just so.
Could you just address why some people are unable to get tests? We've heard from a woman, for example, who has been to New Rochelle recently, that lives here in Connecticut, and is concerned. She's exhibiting no symptoms, but she can't get a test.
That's correct.
Because she's not in the protocol. Because if she had symptoms, she would get a test.
We can test 40 to 60 people a day at the State Public Health Laboratory. That testing is for every acute hospital in Connecticut. For people get sick with pneumonia and acute respiratory distress all the time. And our hospitals need to know which one of those is COVID-19 so they can take appropriate precautions. This is taking all the resources of our lab right now. The focus of our laboratory testing is keep the hospitals open, protect the healthcare workers in the hospital. In New York State, the New York State Laboratory has a large capacity for testing, and they are recommending that Connecticut residents be tested who do not have symptoms, and then telling the Connecticut residents to go back to Connecticut to go get a test. I've actually reached out to the New York State Health Department about that issue, because they're in a different place than we are in terms of test availability. Right now, we are not testing people who are not sick, and we are not testing people who are not sick enough to be admitted to the hospital.
Dr. Cardano, would you be kind enough to address the issue with the schools? We've seen several more school districts close in the past 24 hours for cleaning. Would you be kind enough to tell us the impact? What are you hearing from the schools, and do you expect more to follow?
First of all, I commend the superintendents who have taken the action to limit events of students, more than 100 students or 100 guests in the schools. Currently, Region 14 is a district that closed. There's a school in Stratford, and today Westport schools closed, not because they have someone with coronavirus, but because they have a student that might have had potential exposure to someone with it. So that's the update with the schools. I think what we're asking districts to do is to continue to limit activity where there are over 100 people in attendance. And, we're all going to experience inconveniences with this, but the decisions we make in the next week or two are going to protect lives. So we encourage districts to continue to limit large gatherings. Thank you. We have gotten one request, and there are several in the queue.
Can you tell us where that is?
We have a request from Glastonbury schools. We have several requests that are probably be coming in, and we're manning the email link to superintendents with 2 staff members from the State Department of Education. So every request or every question from superintendents receives an answer within an hour.
Are those routinely approved?
Well, we'd be reviewing those, and it would actually be a function of the State Board of Education, so we're engaging them in the process. Thank you.
Doctor, can you tell us how many of the 10,000 folks who arrived at JFK from China are Connecticut residents? Was that broken down?
I don't have that figure, but this is what I would like to share with you about that. We monitored, starting in mid-January, more than 150 travelers from mainland China in Connecticut. Of those, maybe 4 or 5 developed symptoms of fever and a cough. They all tested positive for influenza or one of the other respiratory viruses. None of them had COVID-19. The first 2 cases of confirmed COVID-19 in Connecticut involved, the first case was related to travel from California, and the second case was related to travel from Nevada. So the focus no longer is on international travel. The virus is in this country.
How many cases has the state lab tested and how many are pending testing?
Well, I have a piece of paper with that number on it. Hold on a second. We've tested 74 individuals so far. 71 are negative. So 3 positive, 71 that are negative. We have another 16 pending for today.
How many after that are still waiting? Is the 16, will that clear any wait for?
No, there are any specimens that are received after 10 o'clock in the morning go into the runs, may go into the runs for the next day. Our lab is running 7 days a week, at least 2 shifts. They're training. Right now there are 5 individuals who are certified to do this test at the state laboratory. Next week, that total should be 7, and they expect to be running 3 shifts. As I said, our goal is to make sure our acute care hospitals have the testing that they need.
Would you suggest that Connecticut residents not leave the state or just not go to any large functions?
Well, certainly it's already been recommended that older people who are older than 65, like myself, should consider not attending large crowded events. That's a national recommendation that's already been made. My daughters have already told me that if they catch sight of me anywhere near a crowd, they will drag me back. And I think all of us probably might find ourselves in similar situations. So that's what's currently recommended. We are not going to take the path of China. The experiment, what's going on in Italy right now is unique. You may have heard they've closed the entire country by regions and prevented travel between regions. It is an experiment in social distancing. All of us will be interested in seeing what happens. They're trying to do that to knock down transmission through the whole country. That's not the plan in the United States. The plan in the United States is to close those things that we can close and stay open for those things that need to stay open. I mean, people still need to go buy groceries. That's why we're asking them to self-monitor. You may have seen pictures of China where they have people delivering boxes of food to people who can't leave their apartments. We're taking a different approach here. We're trying to keep some things open so that day-to-day life can continue as best it can in the middle of a pandemic.
One more question.
Just one more question about older people,
Yes.
Doctor. And you're talking about older people with existing health problems, not older healthy people.
Even older healthy people, 65 and older is an increased risk. And if you have other diseases in addition to being over the age of 65, your risk goes up. And that includes me. It might include others as well. And so this is something we all need to be aware of.
Great. Thank you very much.
Thanks, guys.
Hey, Al.
Sorry, guys. We have